As Nigerians prepare for the festive season, the Nigeria Center for Disease Control and Prevention (NCDC) has issued a public health advisory on the prevention of Lassa fever and other infectious diseases. Speaking during a press conference, Director General of the NCDC, Dr. Idris, highlighted the ongoing Lassa fever outbreak and measures to safeguard public health, urging Nigerians to celebrate responsibly and prioritize their health during the festive season. Dr. Idris noted that Lassa fever remains a significant threat, with over 9,492 suspected cases and 190 deaths recorded this year. Most cases are concentrated in Ondo, Edo, Bauchi, Taraba, Benue, and Ebonyi states. According to the DG, the disease, which peaks between October and May, is primarily transmitted through contact with infected rodents or contaminated materials.
More importantly, we're going to Christmas, New Year season. It is essential that whilst we are celebrating, we should also remember that we are at risk. One, in this Yuletide season, people tend to eat all sorts of things. If we have to check exactly what we eat, because around this season is too, cholera make rice. That's one bit. Mpox, again, people come across each other, they celebrate, so the chances that some of this may go up. So we'll continue to watch. Because we are seeing many suspected cases, doesn't mean that we should be alarmed. As soon as these cases are suspected, it's better for them to seek medical advice so that they can be seriously put on treatment. Lassa fever can be treated. Once the people are put on this antiviral ribavirin, it's part of the things again we've circulated to all the states. We're still circulating so that they have them in stock. Cases are suspected are placed on these drugs, and most of them are treated. The typical is the rats are infected. Once the rat gets in contact with the people, people can get infected. The other worst one is that from infected people can also infect other people. So the common thing is that if we can break the transmission, we will reduce the number of infections. And we have heightened our surveillance activities and preparing for this outbreak season. Critical medical supplies, infection prevention and control materials, and laboratory diagnostic tools and materials in terms of consumables, reagents, testing reagents have been distributed to the various states nationwide.
The NCDC said it has activated a Level 2 Emergency Operations Center and distributed essential medical supplies nationwide. Enhanced surveillance and diagnostic capacities have also been implemented, with 13 Lassa fever testing laboratories now operational.
Always keep your environment clean, especially our homes and markets, dump sites to reduce the breeding grounds for rats. Block all holes in your households to prevent the entry of rats and other rodents. Cover your dustbins and dispose of refuse and waste properly. Communities should set up dump sites far from their homes to reduce the chances of the entry of rodents into their homes. This came up because in some parts of Edo State, they had these communities where they developed these dump sites in the middle of some areas there. This is where they attract rats. Safely store food items such as rice, gari, beans, corn and maize, etc. in tightly sealed or well-covered containers, and avoid open drying of foodstuff. Properly process or prepare rats. Some of them we call bushmeat because you don't know what is bushmeat. All sorts of things are called bushmeat before consumption. Avoid drying foodstuff outside on the ground or roadside where it is at risk of contamination. Discourage bush burning and deforestation, as this can destroy the homes and food sources of rodents, driving them to migrate from the bushes into human residences to find food. If you notice any of the signs and symptoms associated with Lassa fever mentioned earlier, or call the State Ministry of Health or our hotline NCDC 6232. This is essential because early identification and treatment of cases are more effective and can save lives.
The center also emphasized the importance of hygiene, proper food handling, and avoiding overcrowded gatherings to reduce the spread of infections.